Hey, hi everyone. Welcome to the today's webinar. My name is Mrinal Srivastav. I think let's wait for one more minute to start right now. Yeah. So my name is Mrinal Srivastav and I'm part of GS Lab Gavs since last 13 plus years. I'm working in security space since last 15 years. Started my career as developer, contributing in IAM product development, and off late do a lot of assessments, roll out the IAM or zero trust architectures, evaluate the security architectures, largely in BFSI or healthcare domain. So today I have joined by one of my partner called Nick from Okta. Welcome, Nick. Would you like to introduce yourself?
All right, no, thank you very much. I'm happy to be here with you. My name is Nick Apostolou. I'm a senior product marketer at Okta with a focus on the healthcare and life sciences vertical. So the core focus of myself and Okta as a whole is to empower healthcare organizations to harness IAM solutions to meet their critical business goals from optimizing patient experience, strengthening security posture, increasing clinician efficiency and so forth. Prior to joining Okta, I've been in throughout my career in various points of the healthcare technology ecosystem, from revenue cycle management, patient portals, payments, and as well as population health analytics. I'm looking forward to speaking with you today, Mernal.
Thanks, Nick. Very relevant background. So today's topic of discussion is actually securing healthcare with zero trust. Since many of our participants are from different areas, some CISOs, and we have some highly technical and non-technical people as well. So we'll cover zero trust from general point of view. What is zero trust in general? Then we will take about zero trust in healthcare domain, why it is critical for healthcare organizations, what are the challenges to implement zero trust, and the future path. And for my audience, I just want to let you know that there will be poll in between. So be attentive, and we are expecting your participation. Uh, be there in the polls. So Nick, like I mentioned, we have a variety of audience. So I just want to start with the layman, how we can classify what is zero trust, right? So zero trust for a healthcare, you can imagine that if you are treating a patient and you are inside a hospital, so there are multiple employees, right? There would be nurses, there would be doctors, there will be clinical staff, there would be other staff there. So anybody with white coat, we cannot consider them as a doctor, and we cannot provide them the information, right? Some patient information or what kind of accesses they are expecting to have that. So we have to verify that, and by default we have to assume that everyone who is coming need to be validated. So assumption is no assumption. Nobody is trustworthy inherently. So we have to verify the identity with each request. Continuous checks need to be done for any request made by the any staff inside the hospital, what kind of access they are asking, and try to give that permission or that access limited for that time, which we can say that minimal access or least as access granted for that timing. So that's in general, in layman term, we can say that, call it as a zero trust architecture, right? In real world, if you see, this is required to protect your patient portals, right? How we can do that by applying MFA, or we are applying some elevated privileges, or by implementing the adaptive authentications. How we can secure the remote accesses. Now in hybrid environment, many people are working remotely, right? There are different type of healthcare stuff, especially security of our IoMT devices, medical devices, which is coming in the landscape. And there are multiple type of devices involved in a hospital or a healthcare organization nowadays. So how we can secure that, uh, and the containment. So we have to assume that breach will happen, right? That's one of the key thing for zero trust. So if breach happen, how we can contain it. So these are the some of the things which I think, Nick, zero trust help us to implement when we implement it in layman term. I just laid out this landscape for our audience to understand zero trust in general. What is that? So Nick, would you like to give more insight on technically what zero trust is? There is a lot of buzz around, right? Zero trust since last 1 or 2 years in
Yep.
Gartner conferences, or all analyst firms are actually talking about implementing zero trust. So what are your insights on that?
Yeah, absolutely. So, and I think you hit the nail on the head, right? It is definitely top of mind and highly topical, especially in the healthcare space, given the amount of breaches that do occur and how costly they can be. So, from I guess a high level, right? Zero trust is a security framework that assumes that no implicit trust within or outside of the network. So this requires continuous verification of every single access request. And it's based on the idea that no person or device should be granted trust or access to an organization's IT systems unless it's explicitly necessary. You hit on this earlier with the thought of least privileged access. And this is also built on the phrase or principle of never trust, always verify. And this means that no user or device should be trusted by default. Every access attempt must be verified before granting permission, whether they're on a supposedly secure network or not. So effectively, it's always double checking and validating before allowing access to such sensitive information or systems, which, as we know, is the case in the healthcare space. I'll also add, right, there's a handful of different pillars that are critical in the zero trust architecture. I'll talk through just a handful of them, being user identity, device security, network segmentation, and least privilege access. So what do they all mean, right? User identity is going to be managing your user identities with a strong ID verification mechanism for authentication, things like multi-factor authentication or SSO with identity providers. Device security, that's ensuring strict controls over device compliance and health checks, right? So checking for updates or endpoint protection, encryption, all of these things. And it also includes endpoint detection and response, or as well as mobile device management policies. Network segmentation, now, on the other hand, is division of the network into smaller zones or segments to limit the lateral movement from within an environment in the event of an access breach. So, kind of stopping the bleeding, if you will. And then each zone there is going to be secured with specific access policies. And then lastly here, least privilege access, which you touched on earlier, and just to reiterate, the idea and practice of granting users and devices only access to the resources that are truly necessary for the role or a specific task. This is an area where RBAC, as well as attribute-based access controls, really come into play for fine-grained access. So I mean, really to sum it up, zero trust architecture is playing a pivotal role in safeguarding sensitive data, which is always going to be present in highly regulated industries such as healthcare, where it's obviously, critical for maintaining HIPAA compliance first and foremost, for those of us in the US. And this is just a couple of the different ways from a technical standpoint, zero trust architecture can be distilled down.
Yeah, absolutely, Nick. I think you have mentioned some very good points related to the pillars. I think it's time for us to start with our poll also. But to continue what you mentioned, Nick, like zero trust is not just one thing. Like you talk about some of the core pillars we implement and it is done. It one of the another key aspect, like you were saying, I just want to continue with that thing, is the continuous monitoring of the activities which is happening, right? Zero trust mandate that you continuously monitor whatever is happening on ongoing real time basis. It starts from your user activity, your UBA, device health, network traffic, everything, and then it brings a factor of risk, and as per the risk which we are seeing, either with the user request or user behavior, how we can elevate the security or the second level authentication we can challenge, or what threat detection we can do at the runtime. ITDR is a new terminology which is coming, right? That is used for threat detection at runtime with identities. Similarly, for continuous threat detection, how secure is our device when we are raising the authentication request? What is the UB? What is the risk score for a user? There is a new OIDC protocol is also on the way, right? CAP, which will have the risk score embedded in the authentication request. And then it help us doing the data exfiltration or compliance enforcement at the runtime. So SIM or your SOAR platforms can help you fix those detect. And like you mentioned, network segmentation. With this continuous monitoring, if we detect the threat early, we can do with micro segmentation. We can limit the impact of that breach, and we'll try to avoid uh, further penetration of that in the environment. So, like Nick, you talked about some very good points about zero trust and the pillars of it, especially least privileges, micro segmentation. What do you think? Why it is so critical for healthcare?
Yeah, so that's a great question. So I think some of the things I touched on earlier, right? There's a bunch of unique challenges that are specific to healthcare. It's highly sensitive patient data. Obviously, there's compliance requirements. I mentioned HIPAA for the US, GDPR is an example for the EU. And we've seen time and time again, even just this year alone, with some of the largest breaches in modern history for healthcare data. It's increased cyber attacks, whether that be through social engineering or advancements in technology, which we'll get to later, or things such as ransomware. Right now, I know there's a lot of common breakpoints within the ecosystem. An example would be like a help desk operation, whether that be for password resets from an internal perspective or from the patient side, right? So, implementing solutions that help mitigate that risk and add that extra layer of security. I think that's certainly something that really underscores how critical this is for healthcare.
Yeah, just to add, like you touched upon on HIPAA and PHI. In my experience, Nick, what I have seen that many of the hospitals, even today, they don't have modern, not even modern, they don't have IDAM implemented as such. So handling PII data or HIPAA compliance or PHI or even GDPR compliance are required at many healthcare organizations now. It's kind of a manual process, right? And it leads to a lot of error prone things. And then, like you were saying earlier, it is whole sector is very regulated, right? Whether it is US healthcare or across the globe, we have to follow a lot of regulations and submit the reports. Audits are happening. So bringing automation is the another aspect which zero trust will help. Protecting your PII, implementing RBAC will help you comply with securing your HIPAA compliances. Similarly, list coverage, like you talked about, is a key thing where all the accesses can have a minimal access for the performing the operations which need to be done at that time. Remote workforce in this hybrid model is another key aspect which I believe zero trust is providing to the healthcare organizations, because there are different type of users involved in a healthcare organizations, not just clinical staff or medical staff. There are background IT teams as well nowadays, right? You have your support teams, you have customer care teams. People are booking appointments. So these customer teams many times are working remotely or from some remote locations, offshores as well, right? So providing or securing that is also very important. One of the challenge which we have seen with healthcare in last 2 3 years are attacks happening through the supply chain. where your vendors are introducing ransomware or some holes in the system which get penetrated to your healthcare organization and then resulting into ransomware attacks. So I think zero trust is beneficial from that perspective as well, right?
Yep.
So just to continue on that aspect, like you mentioned, you have deep background about in healthcare domain, and you briefly talk about uh, why it is critical. So while we say it is critical, and you talked about the identity security and point protection, what benefits do you think it will bring when we are implementing zero trust as an organization? And again, healthcare as a sector is very complex, right? They have legacy applications, they have legacy systems, they have HIS, they have ERPs, they have vendors, they have temporary workforce. So how do you think that what kind of benefits can be achieved uh, for healthcare organizations with zero trust?
Yeah, so I think starting with that, right, like it's underscoring and really highlighting how valuable healthcare data is alongside the increasing attack surface, right? So, healthcare records are highly sought after by cyber criminals. There's a wealth of PII within them, whether that be medical history, payment information, social security numbers. And with kind of this rapid adoption of advancement in technology, a lot of it exacerbated by COVID, if we're being honest, right? So moving towards more remote work models or hybrid telehealth and the advent of that. And some of the other areas you talked about, such as IOMT, and this has really just expanded the available channels for bad actors to capitalize, right? That coupled with a number of legacy systems that are already in place, this ultimately is leaving a lot of organizations vulnerable. So by implementing zero trust, right, and these principles, it helps obviously build that base level of compliance with HIPAA and securing personal information, but it also it improves secure remote access for the providers, protecting different devices, and honestly, a really important piece of this is ensuring patient trust. Right? They want to be. It's already a significant item when they're going to visit their doctor. That's meant to be a highly trusted interaction to begin with. Not having to worry about your data getting leaked out there is an extra layer of peace of mind there. And one of the ways that this can be done obviously is with robust IAM or identity and access management tools. And this is the goal of this being right, like let's provide security without sacrificing the UX, both for the staff as well as for the patient. We talked about identity security earlier and features like MFA or SSO to help deliver this in a way that's seamless and secure. But beyond this, there's different types of endpoint protection that are providing peace of mind that devices are in fact locked down. I'll add, right, from an additional benefit to this architecture that we're talking about, right, is behavioral analytics, which is highly important in the space, right? So this is something that can feed directly into your security features, which are enabling you to bolster your posture from an overall standpoint and really being proactive as well as reactive to the threats as they arise. So, making sure that you're highlighting and securing the front door, if you will, before the time of an attack. But if in the event it does happen, all the checks and balances are in place so that you can effectively shut things down as quickly as possible. Things such as like a universal logout, so prompting everyone to re-authenticate and sign back into your system, just as an example.
Well
Um,
said, well said.
awesome. And from your standpoint, I'd love to understand, right? Like, what should the zero trust journey look like for a healthcare organization?
Okay, so journey point of view, I think you covered very good points, and it should be a poll question. Some of the things which you covered, I'm really,
Yeah.
those insightful things were really helpful. So journey for healthcare organizations, like I was talking earlier, is healthcare is little complex as an organization, right? They have They have complex legacy systems, they have complex HIS systems, ERPs, they have their own applications now due to third-party vendor applications. Many applications are in cloud, many applications in on-prem. There are different type of users. There are different type of data stores at different places. So implementing the key pillars like you talked about, right? Microsegmentation, which is at network level, identities, which is at an identity level, talking to all applications from your HRMS to the end application where user is accessing or access or least privilege accesses or RBAC if we have to implement or ongoing continuous monitoring we have to do. So it involves a lot of things like endpoint protection you talk about, device security you talked about. So there are so many things to it. So to do this, we typically recommend prepare, plan, pilots, and implement kind of a strategy. So as part of preparation, you discuss developing the strategy to build with the zero trust, right? Identify all your assets, your what is there in your inventory, what systems are there, what kind of data is flowing from one place to one. So all those preparation goes into, and then allocate some budget for that activity. Then move into the plan. So plan actually going little deeper in your inventories, how data is flowing from one place to another, defining those data flows, especially for your PII and PHI data we talked about, right? It is very important in healthcare organizations. There are different security standards and compliances to be followed, then list down all those which need to be followed. Carve out the frameworks. There are recommended frameworks which need to be implemented as the security architecture, and then start with the assessments. In assessments, we move to the third stage called pilots. So as a pilot, we identify only one segment, right? One data flow maybe, which covers end to end from your asset inventory to data flowing till the end where user is getting access. So that pilot will give us end to end GTA structure where we have identities in place, we have least privilege access controls are back implemented, we have device security implemented, we have done microsegmentation for that flow, and then we can test it, right? So these kind of pilots will give us more confidence and will eventually help us to carve out the complete zero trust architecture for the organization, and then come up with the implementation plan and then move into the implementation. So the key objective is to get the executive buying and budget allocations for the whole GTA project. Once we do the pilots and we show to the executive body how our GTA is going to work and what benefits we are getting, like you talked about, it's not only that you are securing the things. GTA is actually helping you with the HIPAA compliance, uh, data encryption. Your data flows are well defined. You know from where your data is flowing. You can define the strategies. Your least privileges is securing it. Your PI and PHI is protected now. So getting executive buying is easy. You can have budget allocations, and then you can start with your zero trust journey. So this is the typical roadmap or journey we recommend and follow, which we have done with healthcare organizations. From IAM perspective, Nick, since you are in this area and Okta is the key player, one of the large player in IDAM space in general, how you define zero trust journey for the healthcare organizations?
Yeah, I think it's a great question. I think I agree a lot with what you said, like from a foundational standpoint. I guess I'd start with understanding where you are at in your current state, right? So as a starting point, not everyone's going to be at the same point in their journey of digital transformation or zero trust. Some are going to be more sophisticated in the types of solutions that they deploy and employ. Beyond that as well, there's other things to consider, such as the size of your user base, or that being both internal and external, whether that be patients or partners, as well as budgetary constraints as well, right? Whether you're a for-profit or not-for-profit healthcare organization, that all plays a significant role into all of this. I think that, as well as taking the assessment to understand all the moving parts in place. So, what are you using for your ERP, for your CRM, your EHR, for example, and all of that? How are they all connected, and moving together? And then how can we now inject identity as a way to make this flow as smoothly as possible while also being secure? So, this brings into consideration things like passwordless authentication and sign-on, using things such as like a biometric, where it's hard to replicate, um, and it's unique to the individual. It's ingrained in their identity. Using risk scoring to feed into the security features, as I touched on earlier. That also plays with device security. Are you on a trusted network? Are you leveraging VPNs? All things that are critical in the space. And then adaptive authentication, I think, is also critical, right? So it's important, obviously, to authenticate and do so as stringently as possible, but in a way that's not inconvenient for your staff. So really understanding your user base as a whole, as I mentioned earlier. I think an additional piece of this as well, two of them, if I'm being frank, is one, understanding whether or not you have a high demand for on-prem versus cloud versus a
Right.
hybrid model. I think that's significant, obviously, in the healthcare space where so many deployments are done on-prem. What works best for your organization? And I think there's also a governance component in here as well, right? So ensuring that the right person has the right access to the right resources at the right time. I promise that's the most rights I will say in a single sentence on this whole chat, but I think it's important to drive that home.
I was going to ask you this question. You touched upon it briefly. While we are implementing zero trust, or when we talk about zero trust, we means in general, from IAM perspective, what I've heard or what people understand, it is more of passwordless, using biometrics, and if you have implemented it, you are close to zero trust, right? Some of the vendors you may be seeing that they are promoting their products saying to implement zero trust, implement passwordless authentications. What is the role of, means in your view, what do you see, what is the role of SODs or implementing RBAC in detail while we are implementing zero trust architecture?
Yeah, I think it's critical because it goes hand in hand with one, the adding the security, but two, it's streamlined access to the right resources, right? I think making sure that your role or the specific attributes of where you are or your device align directly to what you're trying to accomplish with a given task or the confines of your role.
Right, right. Thanks. Well said, means, and that is how we are achieving least privileges and ensuring that maker checkers are also there while authentic means requests are happening with SODs. So, in your experience, Nick, would you like to share some biggest challenges healthcare face when they are trying to implement zero trust? And if you have suggested how they should overcome, if you can share some insight on that, that would be really great.
Yeah, absolutely. And I do think I touched high level on some of them in the
Right.
previous area, right? But I think a key one is legacy system integration, right? So in many cases, there's outdated systems that lack the APIs or even just the interoperability needed for zero trust architecture. So retrofitting into this can obviously be time consuming and resource intensive. The other consideration is that data is oftentimes siloed in an organization. So it's scattered across multiple departments or even business units, and that makes unifying security sometimes difficult to control. Beyond that, right, there's also the factor of operational disruptions, right? I talked about being as seamless as possible. In delivering a UX that people are going to want to use. So there's going to be some level of operational impact to workflows, which is something that needs to be considered, particularly in emergency situations. We've heard complaints, right? Like those are who are in emergency medicine are more like, or surgery, for example, might be more likely to push back on things like authenticating time in and time out. Um, but that said, right, like it's also it's that's why it's important to have a frictionless experience as much as possible. And then lastly, right, resource constraints. Smaller organizations or not-for-profit healthcare systems may lack personnel or budget for, completing a full-scale implementation across the board. Now, mitigating this, I think it starts with organizational alignment. And this comes from concerted efforts to modernize and conducting assessments of your network and strategic phasing to make sure that you're doing this in a scalable manner, as well as educating the various personas across your organization. So not only is everyone safely using technology, but they're doing it in a compliant way.
Great, great. Well said, well said. Means I think it's time for ask us another poll. I just request our audience if they have any questions, they can post in Q&A, and we will take those questions quickly once we finish at the end of the our discussion. Nick, you have touched upon some very good points, and I completely in agreement with you, especially the point you talked about the business alignment. Because what I have seen in general, not implementing zero trust architecture, but whenever we run any security program, there are a lot of objections from different business stakeholders, right? It take a lot of time to convince them. You need your executive sponsor support, some influence to convince them. But like you mentioned, right, if we do proper business unit alignments, we make them aware about the benefits of the security program or the security architecture which we are going to implement, what they are going to get, especially in healthcare. Like zero trust architecture is not only an architecture for certain thing, it actually providing you end-to-end security, where from your desktop login or from where the login starts with your authentication request till the end when access is happening. You are covering your endpoints, you are covering your device security, you are touching on your network microsegmentations, your network security, then continuous monitoring and all that's wonderful. uh, to wrap up our discussion, I would like to ask you first last question. Means with zero trust, like we are seeing, there is a lot of buzz and many organizations are adopting. Gartner, I think in 23 mentioned that by 25, some 60-70% organization will adopt it, but I think healthcare is still behind. But recent buzz is around AI, right? This whole year, whether it is Gartner or RSA conferences, everyone talking about the AI, and AI is going to disrupt, AI is going to bring new things. What do you think? What AI will play a role in zero trust landscape?
Yeah, it's a great question. And AI, it wouldn't be a 2024 webinar without using the term AI. Um, so I guess what we've obviously seen in the space is it's becoming more widely accepted as a tool for a variety of different areas, right? For example, it could be used for care delivery or improving your call center operations, or even we've seen it in chatbots where they're helping patients navigate through a system or members navigate through claims more effectively. But it also makes cyber attacks more sophisticated, right? So with the likes of deep fakes and the impact that has on identity verification, right? So things like facial replication, voice mimicking, or phone calls to impersonate an individual, it really muddies the water when you're trying to determine who you're interacting with, really. So I think one zero trust architecture is something that is meant to also account for this, but it also comes with understanding and making sure that you have the right solutions, leveraging AI to counteract this, right? So just from the Okta standpoint, we do use our Okta AI for a handful of different use cases, right? So one of the examples being automation of threat detection and response. So having advanced algorithms that feed into the various threat signals and making snap-second decisions in an automated fashion so that you're having a quicker response time. Beyond that, there's also policy recommendations that can be done based on assessing your governance profile across the organization. Beyond that, right, there's also some roadmap items that we're going to be launching in the somewhat near future. Things like investigating various level of threats and analyzing additional governance patterns to make the best informed decisions for a given organization. That's kind of where we view AI, and not just in the space, but from an Okta standpoint. But I'd love to hear more about how GS is looking at AI
Right.
in the space as
Yeah.
well.
Yeah. So we are also using many of the Okta features for our customers, especially like you mentioned, adaptive authentication, AI-driven threat detection. What we have seen with AI in Zero Trust combination, if I see automated responses for your threats is going to be the major thing for your SOAR. How AI can do the continuous monitoring, which is the key aspect of the Zero Trust, and enable or monitor user behavior and enable your anomalies to be detected automatically and bring more playbooks automatically to identify and address those automatically before it raise the incidents. Similarly, security policies, you talked about how we can make those security policies adaptive and then become tied up with the threat intelligence. One of the key use cases which we have worked on, which is actually a Gen AI use case, like I was talking about, the recent attacks on the healthcare organizations were related to the ransomware. And if you go a little deeper to it, it actually originated through the identity impersonation attacks, right? Somebody called at the call center or the customer care, and those customer care executives typically use contact center applications, so they do some basic verification, getting some basic response from the centralized IAM system. They don't understand the complete context of the user, and if somebody do basic impersonation, those contact center executives can be easily tricked, and that is how some of the attacks happen. So what we have built as a Gen AI lightweight tool is we enabling the contact center users to ask more questions about the user which is actually calling, say for example password reset. They can ask questions like how many times this user has tried to reset his password in last 1 hour, from how many locations they have tried to reset the password. So suddenly the contact center executive or call center executive who was having no information now can have more insight about this user. Apart from asking some basic questions about date of birth, etc., they can see these kind of things. And what another thing which we have introduced, where we have leveraged your Okta APIs as well, where we get some basic risk score of the user. We are implemented ML with these kind of factors. We give the risk scores of each user request coming to contact center, right? And if risk score is higher than certain threshold, then your customer care executive may not be able to take any decision. They need to delegate it to the next level executive where KYC or some other process can be done. So this is what we see as a disruptive thing, Gen AI introduction for this kind of a use case where we are actually empowering our executives where they have a limited information, but suddenly they have more information coming through the log sources or the APIs, like I talked about, risk profiling, and then providing more security to it. So here, thanks Nick for covering all those things and providing those insight. I think it's time for us to take some questions. Let me see. So one of the question, Nick, is session management and policies for IP restrictions can be considered part of Zero Trust functionalities. And does emerging technology like AI, where everyone is trying to use, uh, can help us in this from IAM and security point of view?
Yeah, so I
Yeah.
think that actually ties into what I had touched on on the role of AI, right? So using it as AI as a way to automate one, your policies a- across security as well as identity and access management. I'd also say, right, like it also is automating your threat detection and response, which is directly playing into that security strategy that the person is touching on in that question.
Right. Yeah, we briefly covered that. I think this is the right use case of bringing AI, and we will see a lot, like you mentioned, Okta is already implementing it. So you'll see more of these things coming. Another question is many healthcare organizations have only AD and Epic, as they are enforced to have HIS systems and traditional networking in place. So how they can implement or define their zero trust journey. So means what are your view, Nick, here? I think this is true for many of the health organizations. They
Yeah.
have their basic HRMS system, but they store users at several places, right? Workforce, regular workforce is in your HRMS system, but then you have temporary workforce or nursing staff or interns or vendors. They stores in different DB, and they try to create some rules and roles or groups through AD, and then most of the process is manual. And then they have network security, which is traditional. So what do you suggest, Nick, there for their zero trust journey?
Yeah, I think there's a handful of things that they can do. Right. So I think obviously first and foremost, it's defining what the scope and the goals are of your organization. So, what are the critical systems and data and workflows that you need to protect? And then again, what are your overall organizational goals, whether that be remote work or preventing lateral movement, so on and so forth. Beyond that, I think it comes down to bolstering your identity and access management, right? So implementing things such as MFA, centralizing your identity as much as possible, and enabling modern authentication methods by, where possible, using cloud-based solutions. Um, I think another aspect of this is looking for ways to improve visibility into your environment as well. So monitoring your network traffic, having inventory of the devices and applications and users, right, including all of the unmanaged or shadow IT resources. We touched on it before as one of the key pillars, right? But implementing least privilege access is something that's obviously critical for doing this as well. Things like RBAC or just-in-time access as well, to provide temporary access to sensitive resources are good ways to do this. Alongside with, things like device security controls, which we've talked ad nauseum about. And then I think one of the other key pieces, right, like as you're going through this journey, is to continue to monitor and automate your processes and data as much as possible. But again, it's the concept of Rome wasn't built in a day, so doing it in a scalable way for your organization is always going to be critical.
Right. Another good question here is we are talking about tying up authentication with device security or endpoint security. So does IAM systems support policies where we can type authentication request with device security and endpoint security? How does that work? Means it's a good question. What do you think, Nick? How Okta handles this, right? Are you getting feed from endpoint security, or do you have your own way of handling device security?
I think it varies by organization, right? So it's all about, again, configuring your setup in a way that works best for you. Ideally, right, you're using, a vendor where it all can be handled in-house, the whole from soup to nuts approach. But again, having an extensible platform such as what we like to do at Okta, you can bring multiple pieces together to work together in a way that best suits the organization's needs.
Great, great. Another question is, in order to implement zero trust journey, we talked about pilots. Can we do pilots in portions, say only for network microsegmentation or IAM? So yeah, means if I have to answer it, like I explained in the process, it's if we have to implement zero trust architecture, so it talks about zero trust architecture is talking about the core pillars of it, which covers your authentication, your device security, your endpoint security, your network microsegmentation, and continuous authentication, continuous monitoring and authorization. By default, never trust. That's the principle we follow in zero trust. So if we have to do, say, only microsegmentation or only IMPs, we have to see and define as a strategy how, even while we are doing it, we can complete the zero trust principle, all pillars covering it. And at pilot, we can do that. Like initially I talked about, we have to look for a flow or a segment where we are doing end-to-end all pillars of zero trust and define that as a limited scope. Then I think we will see the real value of zero trust and how it is going to provide us the benefits, especially in healthcare organizations. If we do it in silos, it may not give you as a zero trust architecture kind of a result. It then again more of our previous security architectures which we follow, like doing network security in one segment, I am in another segment, and it is not actually the zero trust architecture. So my recommendation would be to pick a flow, and if you want to focus more on one area, we can do that, but it should cover end to end all pillars. So with that, we have few more questions. Maybe we'll write back to them, reach out to them. We are on time now. We have to wrap this up. Thanks, Nick, for joining and sharing all insights. Your information which you have shared is really useful. I'll request all the attendees to provide the feedback once we close this. Thank you, Nick. Any closing comments?
I just echo the same sentiments. Really grateful for the opportunity to speak with you today, and great getting to hear, the GS Labs perspective on zero trust and, the things that can be done from a healthcare perspective. As we know, right, like it's a significant journey and undertaking. So really great to hear how, your perspective on how this could be done. So thank you.
Right. Thanks, Nick. Have a good one. Have a good one, everyone. Bye.